Have you ever felt that gentle nudge telling you there's something more? That the path you carefully planned might not be the one that you're meant to take? I'm Marisa Switzer, and this is If I Hadn't Said Yes, Stories of Surrender and the Pursuit of Purpose. Each week, I sit down with women who have trusted their journey, stepped into the unknown, and discovered their true calling along the way. Whether you're feeling called to make a change or simply seeking inspiration from others who have taken the leap, this is your invitation to explore what might be possible if you say yes. Hi guys, and welcome to this episode of If I Hadn't Said Yes. I am having a little bit of mic issues, so if the sound quality is not as good this episode, I really apologize, especially because this is probably going to be my longest episode to date. If you are new here, if this is the first episode of If I Hadn't Said Yes that you are listening to, this episode is going to be a little bit different, and so I first wanted to start by giving you some background on the podcast, in hopes that if you like what you hear today, or even if you don't feel like it's relevant to you, you'll still go back and listen to some of the really impactful conversations that we have had over this season. So If I Hadn't Said Yes is all about the big yes that has changed someone's life. It is stories of surrender and the pursuit of purpose, and I really encourage you to go and hear all of the incredible stories that I've gotten to share this past season. For the month of May, we are doing a series on motherhood. So if you are just tuning in for the first time this month, go back and listen to my motherhood episode, week 1 of May, my pregnancy episode, week 2 of May, and this is my birth episode. And if you don't know, I did have a pretty traumatic birth. So this episode might be a little bit difficult to listen to. I will definitely give trigger warnings when we get to the difficult parts. As someone who was very fearful of being pregnant, I actually was not very fearful of birth. I think I just had this feeling in me that my body was meant to do this. And so going into birth, I really wanted to be able to share a positive experience of birth. Really, the first 36 hours of my birth were very positive, easy, enjoyable, 10 out of 10, would do again. And so if you are someone who is fearful of birth, if you are someone who's pregnant and approaching birth, I really want to share the positive of those first 36 hours. And knowing what I know now, I know that there was a way I could have arrived at that perfectly healthy, normal birth. Unfortunately, that was not the case. And so the second half of this episode, like I said, is going to be a little bit more difficult to listen to, might be difficult for me to get through, but I just want to share so that others can understand how to advocate for themselves, how to advocate for your child, and how to stand up for what is the safest option for yourself and your child. And also just share the testimony of what an absolute miracle my daughter is. We will get into it. So let's pick up where we left off. In my pregnancy episode, I was in the 3rd trimester, and my pregnancy had been really smooth. I hadn't really had any hard doctor's appointments. And so when I got to 37 weeks, I was very excited because it would be the first time that I was going to get checked and see if I was dilated. And so my husband and I get all ready. We go to the appointment. We're so excited. I was vlogging it for TikTok, and we're in the waiting room, just so excited to see if I've made any progress, because at 37 weeks, you could have a baby in 1 week or you could have a baby in 5 weeks. You just don't know. And so I went into that appointment really excited and expectant, and we go into the room and they start by taking my blood pressure. And for the first time in my entire life, pregnancy, non-pregnancy, first time ever, I have high blood pressure. And me and the nurse just look at each other, because if you're pregnant and you're near the end of your pregnancy, you know that high blood pressure is not a good thing. And so the nurse is like, all right, I'm going to go get the doctor. And my husband is like, calm down, everything's fine. And I'm like, you haven't watched enough birth TikTok. I know what this means. Pretty much when you're near the end of pregnancy and if you have high blood pressure, they are concerned about preeclampsia. And so I knew that
because my blood pressure was high at 37 weeks, I was going to immediately be sent to labor and delivery. And my husband just didn't have that background knowledge. So even though I was telling him what was about to happen, he was trying to stay positive and, tell me to think the best. But of course, the doctor came in and said pretty much that we're worried about preeclampsia at this stage in your pregnancy. I'm going to send you to labor and delivery, where they'll test you for preeclampsia markers. And if you have any, get ready to have a birthday party this weekend. And hearing that was just like a shock to the system, because I'm going in, excited to see if I'm even 1 centimeter dilated, and she's telling me that I could have my baby this weekend. So that kind of started a series of events. I'm not going to go into all the details because it's very repetitive. But basically, over the next 5 days, I would go into labor and delivery. My blood pressure would be high. I would have 0 preeclampsia markers. I did not have any of the markers like protein in my urine, nothing like that. After like half hour in labor and delivery, they'd check me again and I would have normal blood pressure and I would get sent home. And so this kept happening over and over again, where they would send me home. And by like the 3rd time, the doctor who was in labor and delivery that day, who was not my doctor because there's a team of doctors that rotates, told me, if you come back on Monday and you still have high blood pressure, they're going to induce you. So we go home, we get all prepared to be induced. My dad's here to watch the dogs, like everything's ready to go. We pack up the car and I go in for my blood pressure check and it's high again, except this day it's a different doctor. And that doctor says, this is intermittent gestational hypertension. You do not have preeclampsia, and this is not consistent enough for me to be concerned enough to induce you. I would rather you continue to wait it out. And I believe at that point she scheduled my induction for like 2 weeks later and was like, if nothing gets worse, we're going to let your body have 2 more weeks. I was very relieved because I had this feeling of like, all right, my body's going to do it itself. Like, there's not going to be all this pressure to be induced. I'm going to be able to give my body time. And I felt really good with that decision. So that next day, Tuesday, this is 2 days before Thanksgiving, mind you, I have a in-office doctor visit. And so I go to my doctor's office, and of course my blood pressure is high. And it just so happened that my actual OB was in the office that day. And so she came in the room and was like, I don't like this. I don't want this to keep happening. And I've induced people for less, is exactly what she said to me. Hope you're watching on YouTube to get my facial expressions with this. So she was like, we're going to schedule you for induction tomorrow, which was Wednesday, the day before Thanksgiving. And I leave the appointment and I get in my car and I'm bawling on the phone to my mom because, it was a lot of whiplash of like, you're going to be induced, you're not going to be induced. And I had finally come to peace with the fact of letting my body do what it was supposed to. And knowing that that was going to be taken away from me now was hard to process. And I don't think it was fear. It was more of wanting to let my body do its thing. And I'll never forget my friend Lindsay. I don't know if you listen to this, Lindsay, but we had the same OB, and she had texted me while I was in my appointment getting bad news saying like, oh my gosh, I'm here. I saw your car. And so I'm in the car bawling on the phone to my mom, and I see them start to come out and I have to like pull myself together to have a conversation. We go home, we, pack up and we get all ready. And then that Wednesday is like the longest day of your life because they tell you to call in the morning, and if they have a bed for you, you come in and get induced. If they don't have a bed for you, you just keep calling like every 3 hours. And so we're literally just like sitting around waiting to have a baby. And by 7 p.m., they call and say, can you be here in 2 hours, within 2 hours? And we live 3 minutes from the hospital. So we have all our stuff already packed. We go and pick up like a good dinner, knowing that I'm probably not gonna be able to eat for a while. And we get to the hospital and they check us right in. And going into birth, there were a few things that I was nervous about. And if you listen to last episode, you know that I have like a lot of medical anxiety. And so And I know this is things that some people would be like, seriously, but number one, the IV, because I had never had an IV in my life. I'd never had surgery, like nothing. So the IV I was very nervous about. And the epidural, which, most people are. And then third, I was being induced using a Foley bulb, which if you don't know, it's a balloon that they insert into your cervix and they inflate it over time so that by the time you're done with the Foley bulb, you are 6 centimeters dilated and they take it out. And I had heard a lot of mixed things about it being really painful or some people saying it didn't hurt at all. And so when I got into the hospital room, it's this big cozy room, we're starting to get excited. And I don't remember if someone said this to me before I went in or if I heard it on a podcast somewhere, but someone had said, just focus on getting through the next 10 minutes. And so it made the entire experience of birth feel less overwhelming if I just focused on the next 10 minutes. And so, getting checked in, getting the IV put in, getting the Foley bulb put in, I got through all of that and it really wasn't bad at all. The Foley bulb, and again, everyone has different experiences. For me, I was up and walking. I wasn't in a lot of pain. It kind of just felt like mild period cramps. Yeah, that was the beginning of my induction. And honestly, the majority of my induction was very enjoyable. It was fun. We have funny memories. So that is now 9:30 at night, Wednesday, the day before Thanksgiving. And the doctor tells me we're going to, take the night to use the Foley bulb, sleep as much as you can. When you wake up in the morning, you'll be 6 centimeters. We'll break your water and things should move very fast from there. And so we're like, cool, like we're going to have a Thanksgiving Day baby, like by noon tomorrow, probably. I was starting to contract and it really wasn't enough that I was like having to breathe through it. It really wasn't excruciatingly painful. It was more annoying, like trying to sleep and just feeling them constantly. So at about 1 o'clock, I asked the nurse if I could have something. I was like, I don't want the epidural. It's too early. Like some kind of pain med so I can just sleep. I don't mean for any of this to sound scary because it is probably the most hysterical part of my birth. Shauna and I laugh about it all the time. But they say, okay, we're going to give you something called Stadol or Sadol. And they inject it into my IV. And the second it hits my bloodstream, I kid you not, I start having a hallucination that I'm holding on with both arms to one of those doors that's just like on the track in Monsters, Inc. and that I have to hold on like with my whole life. And so I'm sitting in this bed and I'm holding on to my husband so hard. And he's like, you can let go. Like you're sitting down, you're fine. And I'm like, no, I'm going to fall. Like if I let go, I'm going to fall. And for like 45 minutes, I'm just having this hallucination that I have to hold on to the door in Monsters, Inc. or I'm going to fall off my bed. I don't know why. Don't ask me why. And I wasn't like panicking, like, oh my gosh, what is this drug doing to me? If anything, like the whole thing was so funny because the doctor came in the room and she's like, oh yeah, like when we give that to people, I can usually tell if they've done drugs or not. And you obviously haven't because I was having that sort of reaction. So it was just funny. It passed some time, but obviously I didn't get to sleep because of it. And so by 4 a.m., I had asked the nurse, like, do people usually get the epidural this early? Like, I don't really think I need it right now, but I really want to sleep, thinking that I was going to have a baby the next day. And so about 4:30 in the morning, I finally said, just give me the epidural. I think at that point I was probably like 4 centimeters. And again, like not in excruciating pain, but enough that I couldn't sleep, that it was keeping me awake. So they came in and they did the epidural. And again, it was one of those things that I was scared of and it was pretty easy. It wasn't extremely painful to me. And again, I know that some people have a harder time because they get it when they're further along. And so it's really hard to stay still when you're contracting so heavily. And I wasn't at that point yet. I was like starting to breathe through the contractions, but I wasn't like having to hunch over. So for me, getting the epidural at that like 4 to 5 centimeter mark was really easy for me. And so again, we're like almost 12 hours at this point into my induction and everything has been pretty easy and enjoyable so far. And they come in my room at 9:30 in the morning on Thanksgiving and take out the Foley bulb. I'm 6 centimeters dilated, and they break my water. And so we're like, cool. From what they told us, after my water was broken, things would progress quickly. And that was around 10 a.m. on Thanksgiving. By 10 p.m. on Thanksgiving, 12 hours later, I was still at 6 centimeters. I had not progressed at all. I don't remember if it was during those 12 hours, but at some point they did a Pitocin break where they took me off Pitocin to try and see if my body would just kickstart labor on its own. And then they put me back on it to see again if having that break would kickstart labor, and nothing was happening. I had the peanut ball in between my legs. They were flipping me side to side all day. And again, like, I wasn't panicking at that point. We were just kind of having like a chill day in the hospital, watching movies, eating Jell-O. Like, it wasn't anything to where I was like nervous. I was definitely anxious of like, I want this baby to come, but I wasn't like fearful at that time. So 10:30 p.m. on Thanksgiving Day, my midwife comes in and says, look, your water has been broken for 12 hours, and if you do not start to progress in the next few hours, I'm going to recommend a C-section. 2 things here of note. When your water is broken, you and your baby are at risk of infection. The longer that your water is broken, the higher that risk is. And so you're really not supposed to go past 24 hours of having your water broken because you can get an infection, which is why at that point they were concerned of that happening. Number 2, I was very fearful of a C-section before going into the hospital. One of the main reasons that I was fearful of the C-section, not only because I had never had surgery before, but I had just heard a lot of horror stories about like people feeling numb in your chest and not being able to breathe, or like not mentally being present for your baby's birth. But at that time when she came to me, 10:30 Thanksgiving night, I was like, well, I already have my epidural, so is there really a difference? Obviously, besides the surgery, like you would just wheel me down there and we would do it. And she said, pretty much. And so at that point, I gave consent for a C-section, saying whatever is safest and best for me and my baby. For some reason, still unbeknownst to us, we don't know if it was because it was a holiday, maybe lack of staff, whatever it was, they decided to just let me go overnight and see if I progressed. And so about 2:30 in the morning, I believe I was at an 8. And then I remember at 6 a.m., they came in and they said, you're at a 9, take a nap, because once you hit 10, we're going to start pushing. This is where things start to go downhill. So I just want to give a trigger warning. If you are pregnant, if you're someone who is fearful of birth, please re-listen to all those positive things I just said, because it's really not that bad if you know what to look out for. I want to say, knowing what I know now, number 1, you should be able to trust your doctors to do the thing that is safest for you and your baby. No woman who is having a child for the first time, who is giving birth for the first time, should have the burden of that responsibility. However, unfortunately, in today's world, we have to be our own advocates. And knowing what I know now, I would have pushed for the C-section a lot sooner. I would not have allowed them to let me go all night. And even further back, you are allowed to deny an induction if it is not for serious medical reasons. And so because I did not have preeclampsia, because my gestational hypertension was only intermittent, I should have spoken up for myself and said no to the induction, because clearly my body was not ready. Those are the 2 takeaways I have. So now it is 10 a.m. the day after Thanksgiving. My water has now been broken for a little over 24 hours. I am 10 centimeters dilated, and it's time to start pushing. To describe the experience of pushing, all I can think of is that it was like I was standing over my body watching what was happening, but I was not physically present. And the reason I say that is because I pushed for 3 hours, and thinking back to it now in my brain, it was 10 minutes. Like, I didn't have a sense of time that it was that long. One of the reasons for that is because at some point I started falling asleep in between pushes. And so I was just not, again, fully mentally present during the pushing. By the way, I am in trauma therapy, and one of the things they teach you in trauma therapy is to tell your story over and over and over again, because it kind of loses its power over you. So this is a healthy exercise for me, but doesn't mean it's going to make it easy. So 3 hours into pushing, my nurse decides to take my temperature and realizes that I have a fever. What that means is that I have an infection, which means the baby has an infection and needs to come out. And in that moment, she took my temperature and she looked at me and said, "I'm just going to go get you some Motrin for your fever. I'll be right back." When she left, I fell asleep again. And when I woke up, there was 20 people standing around me. Nurses, doctors, the entire NICU team, everyone. The doctor basically looked at me from down there and was like, "I need you to give me the 3 biggest pushes you have, and we're going to get her out." Now, the vacuum part of it was never explained to me. It was just, do this and we're going to get her out. I believe my husband was aware they were using the vacuum, but no one talked to us about the risks or benefits of the vacuum, which, if you want to know the risks of a vacuum birth, look it up, please. Please. I give him 3 big pushes, and I'm laying down, obviously, so I remember feeling something heavy on my stomach, and there was a lot of movement going on, and I kept asking, "Is that her? Is that her?" Like, I thought that they had pulled her out and put her on my stomach and they were trying to like stimulate her. And it was, but for some reason in that position, like, I could not see her. I later come to find out that my husband was holding up a towel so that I couldn't see her color because it was not good. Pretty much immediately she gets handed over to the NICU team that's standing next to me. They're working on her, and again, I'm just like, "She's not crying. Is she okay?" She's not crying. And they just said, "She just needs a little bit of help. Like, she's okay." They need to immediately take her to the NICU, and they hold her up for 0.2 seconds. And because there was just so many people around, I literally did not even get to see her face. They just took her. And Sean went with, and I'm sitting in this room by myself. Everyone's cleared out, even my nurse. And obviously I'm in shock, like, what just happened? But I also have such a high fever that I'm just like very out of it. Like, what is going on? And this part is hard for me because I guess the entire medical team went from my emergency to another emergency. But because of that, after they delivered my placenta and everyone left, no one cleaned me up. No one gave me a pad, a diaper. Like, no one told me what was next. So I'm just like sitting in this room by myself, trying to process what just happened, like half hallucinating because of my fever. It's sad to say, but I don't think in that moment I was even like super worried about Delaney, because they reassured us in that moment, like, "Oh, she just needs like a little breathing help and she's fine." And so it was more like, why am I left here? Why has no one cleaned me up, taken care of me, told me what's next, told me what just happened? Like, it was just that was a really difficult time to just sit in. And eventually Sean comes back, and again, like, no one was really coming in the room or telling us what was next. I remember someone did bring me Motrin to get rid of my fever, but at that point I had not eaten for 2 days, and so I was basically demanding food. Like, "I will not take these until you give me food." I just didn't want to take it on an empty stomach, and I just needed something in my stomach to like just help my body process what just happened, you know? And so eventually they move us to a postpartum room. And at that point, when I'm in the room, like, I vocalized to the nurse, like, can you get me like a diaper, like something? Can someone help me out here? And so they do. Like, I finally get comfortable, and I just remember them like not letting me go see her until I could walk to a wheelchair, which in my opinion is ridiculous. Like, just pick me up and let me go see my baby. There's a lot of anger in how I missed out on those like crucial bonding moments, those first few hours, because it's not just those first few hours I missed out on. I did not get to hold her for an entire day. And then obviously with her being in a NICU an hour away, eventually, like, there was just a lot of bonding that didn't happen in that first month. And so that's just really frustrating for me. It's something I really struggle with because, not only did I struggle with the bond in the beginning, but I still carry a lot of anger because for those doctors, it was just another day at work. Like, they never think about it again. And I think about it all the time. I think that's like the one emotion that's very lingering. Even though I've worked through a lot of the trauma, I still struggle with a lot of anger as to how everything was handled, which there's more. Just wait. Speaking of bond, I think it was around like 7 p.m., which I had given birth at 1:08. And around 7 p.m., I finally got to go to the NICU to see her. I'm in a wheelchair. Sean wheels me to our little NICU room. And it was just, again, like very surreal and very not what you expect having your first baby. Like, I didn't know if I could touch her. She was in like an incubator. I just remember like not really having those emotions of like, oh my gosh, that's my baby, that's my child. Like, it just wasn't clicking. The doctor comes in that night and sits down with us and basically just says like, she just needs a little help breathing and her platelets are a little off. So we're just going to keep her for a little bit and like make sure everything kind of resets itself. And so we're thinking like, all right, we're going to be here like 2 days. The next day, Saturday, we go in the morning to see her, and at this point, I still have not held her. I ask a nurse if I'm allowed, and she's like, oh my gosh, you haven't held her yet? And I'm like, no. So they finally let me do skin to skin. They let Sean do skin to skin. I was still in shock, like I didn't, again, have those like maternal elated feelings. It's hard with like the wires and the whole setting is just really difficult. Like, again, a lot of that bonding is just robbed from you in that moment. That was the morning, and I think I pretty much napped for like a good portion of the day. I got like with the lactation consultant. We actually had a midwife who was incredible come in, and we were able to say to her, like, what the heck just happened? Like, no one at that point had explained my infection to me. No one had explained that she not only contracted the infection, but was having heart decelerations. No one had really explained the vacuum to me at that point. And so for someone to come in and be like, hold on, I'm going to go get all the notes and walk us step by step through everything that happened did definitely help me to understand. So that was very, very kind of her to just really help us process what just happened. And so Sean had to go home to sleep at our house that night with the dogs, which is 3 minutes away. It really wasn't a big deal. I was planning on staying in the hospital anyway because she was still there. So he packs up and he leaves to go home. I'm just going to give another warning. This is probably the hardest for me to talk about and the hardest part, at least for me, to have to process. So I'm in my room by myself and I had pumped some milk and I'm literally like arguing with myself. Like, do I go to the NICU by myself? Again, I just didn't feel like that confidence, that bond. Like, I was nervous to just go sit in that room with her by myself. But I work up the courage to go. I walk in the NICU, I do the hand washing and the sign in and everything, and a nurse looks at me and is like, oh, I'm glad you're here. And it wasn't a smiley, I'm glad you're here. And so she tells me to come back to the room, and I already see that there's a bunch of nurses outside of our room, and she looks at me and says, as you were walking in, she had a seizure. I call Sean and I tell him, obviously, immediately to come back, and he does. The doctor then comes in the room to tell us or inform us, get us up to speed on everything that had happened that day that no one had told us about. There were 2 instances where they assumed that she was having neurological symptoms, or they could start to see neurological symptoms. And so they wanted to get an MRI. And on 2 separate occasions during that time, after I saw her in the morning while I was napping or whatever, they tried to wheel her to MRI. She had an apnea episode, which means she stopped breathing, and they had to bring her back to the NICU. No one told us this. So because they were seeing the neurological symptoms all day, the NICU doctor had already been communicating with other locations of the hospital. The hospital that I gave birth at, not going to name names, even though I would love to, is connected to a children's hospital. However, the hospital I gave birth at was not equipped to handle pediatrics or anything neurological. So all day he had communicating with Central Campus, where the main children's hospital is, and another satellite campus who also handles children, trying to get her transferred to a facility that could handle neurology. And so he's telling us all of this, and we're just trying to soak it in because, again, like, we've been here all day and no one has told us that all of this was going on. We're still just thinking we're waiting on her platelets to normalize and waiting for her to be breathing okay again. He's telling us, I think her best bet is to be transferred. And unfortunately, Central Campus, which is 20 minutes away from our house, didn't have a bed for her. So she had to be taken to Jeff Gordon Medical Center, who I literally owe her life to. And as he's telling us that she's going to be transferred, I guess in my head, I'm thinking they're going to drive her, like that I was going to hop in an ambulance with her and take the drive up. And a nurse peeks her head in the room and says, the helicopter is 7 minutes out. That was probably the hardest moment for me because it was just absolutely surreal. Like, she's about to be life flighted to another hospital. They gave us the option to drive up there that night. They would discharge me early and I would get to go, or go home and sleep and go in the morning. Obviously, I felt immense guilt to even think about not going with her. But I mean, the doctors were all like, by the time that she gets up there and gets checked in and actually gets assessed and has an MRI, it's going to be the middle of the night. And so it might be better for you to go home, get a good night's sleep, and go in the morning. So that's what we had decided, was that we were going to go home and go there first thing in the morning. And all of the team members after this moment were absolutely incredible. The nurses who needed to discharge me, it was going to be a like emergency discharge because I technically wasn't supposed to be discharged yet. They like came back to our room and were helping me just like throw everything in bags, and I'm like panicking to Sean, like, oh my god, the nurses' baskets, like we have to get the nurses' baskets out of the car. And she's like, don't worry about it, like literally just helping me pack up as much as I can. I'm still in a wheelchair at this point, so Sean wheels me, and I come around the corner, and there's just cops and the stretcher and medics all coming towards us. And that was just another like completely surreal moment of like, I can't believe this is happening and this is for us. And so we go in the NICU, and they were going to have to intubate her because they didn't want her to have another apnea episode in the air. And I didn't want to see it. So I went and I sat in the NICU waiting room, which was right next to the exit doors, and Sean was going to stay with her. And he came out to me and was pissed because they would not let him stay in the room while they intubated her. It's just crazy, like, when you're in shock, or like how your brain tries to deal with those moments. I remember sitting there, and there was this like Rolodex of months, and they had these little cards that were like the month anniversaries for babies, you know, like 1 month pictures, 2 month pictures. And I just remember sitting there, like, trying to be positive in that moment and saying, like, oh, we should take these, like, for her pictures, like, not knowing how long we were going to be in the hospital. And so they wheel her around towards the exit door, and the flight medics, who were just incredible, were like, give us your cell phone numbers and we will call you, text you the second that we land. And we will make sure that the doctors get your phone number and call you as soon as she's admitted. They asked if we wanted to say goodbye. Sean went to say goodbye, and he, looked back at me and was like, it's not that bad. Like, you can come look. And it really just looked like she had a little face mask on. And so, like, we said goodbye and we followed them out of the hospital to the car. Outside the hospital was like this U shape where you kind of like pull up to drop off at the hospital and leave. And so Sean had pulled up, we get in the car, and they are wheeling her up, and the helicopter is right across the street from where we're parked. And so we get to like the end of the U, and there's a stop sign, and there's cops blocking the whole street. The cop comes up to our car and he's like, sorry, you can't drive until the helicopter leaves. And Sean was like, it's okay, that's our daughter. Which again is just one of those surreal moments where you're just like, I can't believe this is happening. And he was like, oh my gosh, I'm so sorry, I'm praying for you guys, like, you can go. And so he let us leave, so we didn't have to see the helicopter take off. And so a lot of like my PTSD, like, ironically, isn't really around the birth. It's the helicopter is like a big thing for me. And I didn't know that until she was probably in the NICU, and I was like driving back one day, and I saw a helicopter, and it just kind of all came back. And like to this day, I still really struggle with that. I don't know if it's like guilt that she was up there alone, or just like the severity of the situation is just like symbolized by the helicopter. So we go home, and probably around like 1 a.m., the doctor calls us from the new NICU. Her name was Dr. Yang, which, if you're a Grey's Anatomy fan, gave me some peace of mind that she was being taken care of by Dr. Yang. And, they just kind of said, we've got her checked in, we're going to do an MRI, we'll call you first thing in the morning, she's stable. I wake up in the morning, probably like 6 a.m., and I am so sick. Like, I just got hit with like the worst head, chest, everything cold. And it was probably my body just like coming down from everything. But I call my mom at like 6 in the morning, and I'm like, please come. Because I couldn't even walk across my house yet. Like, I had still been in a wheelchair, and knowing that I was sick, I knew I couldn't go to the NICU, which was like the hardest thing, to not be able to go that first day. You just can't bring germs into a NICU. And so Sean went, and my mom stayed with me about halfway through the day. Sean called me to update me, but the incredible doctors there, like, they were overly communicative. I think actually that Sean might have scared them a little bit, because as soon as he got to the NICU and like met all the doctors, he was like, look, this is what we just went through at the last NICU. No one told us anything. I want to be told about every single thing. And so they were overly communicative. They were incredible. I mean, we could message them on the app any time of day. They were sending us updates all day, calling us all day. They were incredible. But about halfway through the day, Sean calls me to kind of give me an update, and he was like, but the doctor like wants to explain it to you so that you can like understand it all. And so the doctor calls me and basically says, we did MRI, EEG, CAT scan, like everything, and Delaney has a subgaleal hemorrhage, which is a brain bleed, and she also has hypoxic ischemic encephalopathy, which is an anoxic brain injury from lack of oxygen, whether that was from the vacuum or from the birth, whatever it is. So she has these like 2 brain injuries. And on top of that, because of the anoxic injury or the lack of oxygen to her body, she also has kidney, liver, and adrenal injuries. I'm trying to get something from them of like, okay, like, how long do you think this is going to take to heal? Like, what, I remember asking, like, is she going to survive this? Like, is she going to die? Like, can you tell me? He said, I think she will survive this. I have seen babies with HIE who go on to live normal lives, but I've also seen babies with HIE who will never walk, will never talk, and unfortunately will never have a normal life. At that point, she was classified as severe. I know that HIE has different grades, but we were never told a grade. We were just told that it was a severe injury. And so we should expect for her to not walk, not talk, not get to live a normal life. And again, that's just one of those moments where you're like, no way. Like, I'm being told this, and I'm like, that's not my daughter. Like, she'll be fine, And spoiler alert, we are incredibly lucky, and she's an absolute miracle that she is perfectly fine today. Perfectly fine, no medication, graduated all her specialists, all her therapists. She is perfect and a miracle. But in that moment, you don't know. Out of all the fears that I had of pregnancy and birth and all the things, number one, being in the NICU never even crossed my mind, let alone raising a child that was differently abled, because as far as we knew from all of our scans, we had a perfectly healthy baby. And so that was really hard to hear. And I was definitely in denial. And I don't want to say that I had like faith or believing for a miracle, because in that moment, you're in such shock that you really cannot even, think of that. You're just in denial. She stayed in the NICU for 27 days. I've debated doing a whole nother episode on the NICU because it's a lot. It's really emotional. It's really hard. The people that work there are literally angels. I mean, they're taking care of your baby round the clock, sending you updates, sending you pictures, holding them, rocking them, changing them. They were dressing her. Like, the NICU was really hard for me because it became very evident that that bond was missing. I mean, I would go into the NICU and just like stare at her, like, can I touch her? Like, I remember the nurse was going to change her diaper, and the nurse was like, you can do it. And I didn't know, and so I was just very distant from her in the NICU, which was really hard for me. About halfway through the NICU, Sean had to go back to work, which that was probably the hardest part of the NICU, having to drive up there alone, 1 hour there, 1 hour back, just sit in that hospital all day, processing what had just happened and praying to God that she's okay. I want to touch on that faith aspect. If you listened to my pregnancy episode, you heard me say that after my miscarriage, I was really wrestling with, why, God? Like, why would you finally put me in this place of wanting a child, being ready and expectant and excited about a child, to take it away? And then when I did get pregnant with Delaney, I was just like holding so tightly onto control, but I didn't want to surrender it. I didn't want to give it up because I didn't want to lose this one, And so by the time I had given birth to her, all things considered that happened, I had nothing left in me. Like, I would love to say that I sat in that chair, and there were a few times where I like prayed over her, but I truly, truly believe that it was our friends and our family that carried us through that time. I mean, after we got out, I remember saying, like, we literally had friends and family from San Diego to Switzerland just constantly praying over her, checking on us. Like, I had friends that were on vacation in London, and I remember them like sending us gift cards and checking on us, and it was their prayers and their faith that carried us through, because I had nothing left. I really didn't. The miracle that she is so attributed to them and to all of their prayers, all of their faith. Pretty much in order for her to come home, she needed to be able to feed on her own. So when she first got into the NICU, she was on a feeding tube. And so over time, we started bottle feeding her, and she had to do like 75% of her feeds through a bottle in order to come home. And so that felt like forever, and it was very frustrating because they're babies and they're not always gonna want to take the bottle or want to finish their bottle, regardless of if they're in this state or not. She unfortunately was sedated for like the first week of her life. And so to have her like come out of that and then try to do all of her feeds on a bottle was really difficult. And I started to get really frustrated because I just felt like we were never going to get out. I remember like wanting so bad to be home for Christmas. Like, that's all I wanted, was to be able to take her home for Christmas. And like 2 weeks in, she actually completed her feeds, which was amazing. But she started to kind of go backwards as far as some of her internal injuries, like her kidneys and her adrenals were the bigger two that weren't healing as quickly as they should have. She had an adrenal hemorrhage, so along with her brain bleed, she also had an adrenal bleed. And then her kidneys, like her electrolytes and her, I think it's her potassium, something like that, like all of those levels were just really struggling. And so it was like we finally got over the first big hurdle, and now, we got to get over this one. And I remember at some point they even talked about transferring her again to the main campus, and I really didn't want to do that because it just felt like starting all over. But lucky for us, after 27 days in the NICU, on December 22nd, 3 days before Christmas, we were able to take her home. I don't think enough people talk about coming home from the NICU. It's such an adjustment. Like, you're not bringing a newborn baby home. You have had other people taking care of your child for the last month. And so to like have her adjust to us and us adjust to having a baby home and us trying to stick to the NICU schedule, it's hard. I honestly think bringing a baby home from the NICU is probably harder than bringing a newborn baby home, because you're trying to adjust to their schedule or undo their schedule or just figure it all out together. I have so much compassion and just feel so deeply for postpartum moms. Like, whether you had a traumatic birth or not, postpartum is extremely difficult, and I definitely struggled very badly the first like 5 or 6 months. I remember like my friend Danielle came to visit in January, and I don't even remember I don't remember her visit. Like, I was in the trenches, but like deep trenches. Over time, we really started to adjust, had a schedule. The days were brighter and better, and I could leave the house with her. The thing that really got me postpartum was her crying. I physically could not handle, and I think it was part of having PTSD, having postpartum anxiety. I could not handle the screaming at witching hour, 7 p.m. every night when it was time to go to bed, and she would just cry for absolutely no reason. My body would fully go into fight or flight. Thank God for Sean, because we are very opposite. Like, he handles the tantrums and the crying and all that very well, whereas it puts me into fight or flight, and I can't. I would have to go into our shower with like freezing cold water and just like hide, because just to like try and reset my body. And so about 3 months after having her, we decided to move to Alabama. And it was a combination of things. At that point I was going to like 2 specialist appointments a week with her, trying to balance not only having a newborn, but having a high medical needs newborn and trying to keep my business. And so we just realized how much we needed to be near family and near help. And we lived 3 minutes from the hospital, and I think that emotionally, mentally, physically, I had to get out of where everything happened. I needed to just get away, and remove myself. And that was the best decision we ever made, was moving here. Like, we talk about it all the time, that even if we left Alabama, coming here to heal was truly the best thing we ever could have done for ourselves. Not just like the setting here, like being by the water, being by the beach, but like his family has been amazing, and we've met incredible friends, and we just feel like we have this whole village here. Truly, I feel like that was the best decision we ever made, was coming here to heal. In the process, Delaney healed. She graduated from most of her specialists very soon after we moved here. I honestly can't even remember the names of all the different doctors that she started out with. I know we had 5 specialists. And by the time that we moved here, she was down to 2. And since she has graduated pretty much from both, she does like a yearly check-in with neuro, but as of her last EEG, she has no seizure markers. She has not had a single seizure since that day in the NICU when she was 2 days old. She has no deficits. She was ahead of all of her milestones, talking, walking, all the things. She's incredibly smart, too smart for her own good. She is truly a miracle. So if you listened to this whole episode, thank you. Thanks for sticking with me. Even after everything that happened, I truly believe that my next birth will be redemptive and that I will have a good experience, because if I had known how to stand up for myself in this situation, then we wouldn't have had such a traumatic experience. I, like I said, would have opted out of the induction unless it was medically necessary. I would have fought harder for the C-section after my water was broken for a certain amount of time. And now that I know all these things, I truly believe that I can and will have a positive birth experience. And so that's why I always tell my friends, anyone who's having a baby, like, don't let my experience scare you. Number one, not everyone has that kind of experience. But number two, birth can be really positive and empowering and just a really beautiful thing. So thank you for listening. I hope you enjoyed this episode. And next week, we're going to talk about what it is to be a mom now and maybe dive a little bit more into postpartum. I definitely want to talk a little bit more about that. But yeah, thanks for listening.
Thanks so much for tuning into this episode of If I Hadn't Said Yes. If this episode inspired, encouraged, or moved you in any way, your rating and review would be greatly appreciated. Or maybe this episode made you think of someone in your life that you want to encourage to go for their big yes. Feel free to share it with a friend. You can keep up with all of our content at If I Hadn't Said Yes Pod on Instagram. We'll see you next week.